Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Welcome back to our second episode of the Pursue Wellness podcast. And here with Dr. Callie again. Welcome, Doc.
Hello.
What we wanted to do today is just go through more of what this podcast is going to be all about. First time around, we covered the essentials that we believe are paramount to anybody having a chance to be successful in their wellness journey. Today, we're going to cover more of what this podcast is going to be about. Who's it for? What are the topics we're going to be covering? And then starting next time, we're going to start the deep dive into those topics. So this is going to be, I don't want to say overly technical, but it is going to be detailed. We want to do it in a way that is teaching oriented. We want you to be able to take away nuts and bolts application. And so that's what we're here to deliver. Dr. Callie, again, I'm so glad that you're here doing this with me because coming from, I believe, the male and female perspective when it comes to the major topics that surround wellness is absolutely critical. There's things that you experience that I'll never experience and vice versa. And I think there's going to be some great value that we're going to be able to add to that.
Yeah, definitely.
So let's go through them. We're going to play on words. If you're watching the video, you can see my shirt. So pursue, 4 letters, PRSU. We've kind of, in a playful way, used that as the foundation for a rotation of topics that we want to cover on a weekly basis. The first topic, I know this one is probably the most near and dear to your heart, Doc. So
Yeah.
let's talk about the P. This is the physiology and the labs and a little bit more of that, I'll say, functional medicine twist to what we're going to bring to the table. So share a little bit more about that topic, what it means to you, and ultimately some of the stuff that we're going to be sharing with others.
I love this topic. I try to make myself almost not love it so much, but I always come back to how much I love the information of physiology. Actually, this is how you and I got introduced. I just needed more knowledge, and you were the authority in that. So I've taken a deep dive in truly understanding physiology, so much so that I learned this from you, that I'm able to know it and master it, but also back it off and educate so that it can be easily digestible. I think that's huge when understanding labs. I think it's so important to be able to understand the really detailed complex stuff, but then also master even the basic parts of physiology. So those are some of the things we're going to be talking about, like what can you learn from a basic CBC or CMP, and then maybe even what needs to be on top of that. If you do learn or see something out of range there, that's a topic that I absolutely love, and I'm excited to go over with people.
Well, one of the things, and I think back to our very first discussion together, it's a bit of a fire hose approach when you're initially
Mhm.
learning a lot of this information. And the greatest
Yeah,
question that I get, that you ask, that is every single person that's ever entered this space is, now what do we do with it? Right. And
yeah,
that's what we want to make sure it's not just physiology, it's applied physiology, right? If you
yeah.
can't take what you've learned and now put it into good use,
Mhm.
then you just got smarter. And that's not really helping other people to the degree that you could help people with. And
Yeah.
so as we bring this information, and why physiology still is the backbone is, if you know how the body is supposed to work,
Mhm.
you've got a chance moving forward. If you
Mhm.
don't know what normal is and what's supposed to happen, then when things don't go right, you don't even know where to start.
Yeah.
And so coming with that scientific application with physiology is so important, and certainly being able to use labs to your advantage. And I know some of the detail that we'll talk about are, what labs do and don't matter. What markers do and don't matter. How
Uh-huh.
often, all the different things. Should you do blood or urine or saliva
Yeah.
or stool? All these different things are going to come into the conversation and just again help to further move you along in a direction that can better help your patients. That's our bottom line with everything we bring to the table. We want you to be able to better help the people that you serve. And
And
so
I'll
we
say, I do want to add one thing about labs because I know you and I see this a lot. Our patients can look up almost anything. Like, especially with information being there nowadays, you can ask, what does this mean to the internet now? And the internet's going to spit back a bunch of just information to you, but they don't know the next question to ask, or they don't know how to tie every little piece together. And I think that's such an important thing for doctors to be able to learn to help people interpret lab results. It's not just a this line means this. It's a you are this type of person, this is your history, this is your training, this is your diet, and then we get this marker, but we also have these 12 other markers over here that are telling a story. That's what I hope people get out of this. Because that's what I've gotten from learning so much from you is when I look at a patient's lab results, it's not just like they are this piece of paper. There's always a bigger picture to look at for physiology labs.
Well, and it's coming back to the chiropractic premise, which is you're not treating a number, right?
Mm,
We're not treating anything. We're trying to figure out what the body's trying to tell us, getting
right.
the right context, the history, and the
Yeah.
timing of the sample. And especially if they're a female, what part of the cycle were they, et
Mhm.
cetera, et cetera. You're going to talk about all this as we get into the details of the trainings. But if you don't have all of that stuff appropriate, or at least you aren't starting there, you're going to end up in the wrong place at the end of it.
Yep.
And so again, that's we're not just going to talk about that, but that is certainly going to be a huge chunk to the information that we want to bring to the table.
Yeah.
So as we transition to the art, this is where we're going to talk. I'm more particular, but there's going to be times that we're going to talk about rehab and exercise and
Mhm.
movement. And what does the physical body need to be functional? Because
Mhm.
again, we can have physiology, we can have labs that are pointing to certain areas. And guess what? Maybe one of the best things you could ever do for yourself is just move more.
Yep.
This kind of goes back to some of the essentials that we talked about last time, but we've got to be able to move our bodies. And if we can't do it in a way that supports our physiology, that supports what our labs show that we need, then again, we want it to be very systematic and scientific. It's overblown. We want to be science based, quote unquote, but it matters. You want to make
Mhm.
sure that the effort you're putting in, like we talked last week, is going to be beneficial. And
Mhm.
so we want to make sure we're talking about those concepts as it applies to moving your body. If you're going to exercise, what's the best way to exercise? What does the research show? All of that stuff is sometimes take it with a grain of salt if we're being honest. And that's what we want to help to decipher and just, again, put the cards on the table and say, we're coming in unbiased. We just want to give you what we believe is the most effective approach and be able to put it to good use.
Yep.
Uh, let's get to the next one. So the S, supplements, nutrition. If we don't talk about what we're putting into our bodies, again, shame on us. A lot of times that is, for most people, kind of the one and only thing they want to change, which is okay. That's you got to start somewhere. But again, our answer isn't to teach you what pill you can take, right?
Mhm.
It's about what your body needs to operate at its best. So tell us a little more about some of the nutrition and supplement framework that we're going to be bringing to the table.
Oh, this is a detailed conversation that I have with so many patients because a lot of people do like to just take a supplement and not change their lifestyle. So they need to be educated on how supplements are meant to be supplemental. And then we can get into the nuance of like different supplements because some people are taking way more things than they really need. You could get into, even the herbal side of things, the adaptogens. There are some things that we can see based on their blood work. This could be helpful for their physiology, or they don't really need this. This is just a waste for them, and they can get more than enough through food. If anything that I've through my working with patients and through my own health journey, I love to try to see what supplements I can replace with food and just good nutrient dense meals. So these are some things that we can talk about. And then based off blood work, like what is helpful, what is not, is there something that everybody pretty much needs? Because we can't talk about supplements without talking about the quality of our food and things along those lines. So I'm trying to not get too detailed, but we will get pretty detailed into supplements because that also is something I'm really passionate about.
Yeah, and as we kind of, I'll repeat the previous three because it's going to tie so beautifully in with the last topic.
Yeah.
But from physiology and labs to exercise and rehab and movement to supplements and nutrition, there is so much noise out there. And we talked about this in the first episode. So many people sharing so much information. What do you
Mhm.
believe? What do you not believe? And that's what the U is going to be about. It's going to be about the unbiased trends that are out there.
Mhm.
So many people telling you to do this or do that. What
Mhm.
should you do? What shouldn't you do? We're going to do the best that we can to help decipher some of these hot topics.
Yeah.
It's kind of that, it brings you back to the show Mythbusters. I don't know if you ever watched that back in the day, but I always loved
Mhm.
it because they kind of put this idea out there. And then the whole premise of the show is to say, okay, is this either a complete myth that we're going to bust? Is it plausible, meaning maybe it's true, maybe it's not? Or is it absolutely true because we've proven it to be true? And
Yeah.
so we're going to take a lot of the common fad health topics that are out there and just put them through the filter of research, of clinical evidence, of just even, I'm totally fine with anecdotal. And what I
Mhm.
mean by anecdotal is, if it worked for this person, okay, maybe it can work for someone else. Doesn't mean it's going to
Yeah.
work for everybody. And I think that's a general premise for everything we're going to talk about.
Yeah.
Physiology is physiology is physiology, but the way that someone responds to a certain intervention isn't always exactly the same, and it never will be. It's
Yeah.
that whole N equals one concept.
Yeah.
However, we want to certainly apply as much as we can that relates to the whole. But again, you just have to be aware and don't be too dogmatic in your thinking when it comes to, some of these things that are just, we'll say what it is. They're crazy out there.
Yeah.
Um, but yeah, so we're excited. Again, these are the four major areas that we're just gonna do on a rotational basis. We're gonna go through 1 week at a time, release one on a topic, and just keep going. So it is gonna be a more teaching oriented, more PowerPoint oriented. There certainly can be some times that we'll jump on here and do a little bit more interview or dialogue basis. Try to keep it fresh as we can, but our whole goal is to help educate, help inspire you to take this, apply it to your own lives, to your patients' lives, to your family, everybody that you know, and help to elevate the wellness. Uh, and so I'm excited. I know you're excited.
I'm
So
excited. Yeah.
any parting words before we get into the nuts and bolts of our next session?
I just hope that we're able to reach the people that truly want to help people. Because that's exactly how you and I became connected. We wanted to get, especially with the unbiased part, those topics, we wanted to get to that point so that we can help people, help our patients figure out what's worth it and what's not. And that's ultimately our goal here. So I'm very excited to get this going.
Yeah, if you're looking for business advice, that's not what this podcast is about. Now, we're going to
Yeah.
share tips that will absolutely relate to your practice, but it's all going to be about helping you be a better doc, helping
Hmm.
you serve your patients better. That's where the heart of this is coming from, not how you can make more money, because there's plenty of people out there doing that stuff and you can go find them. But we're
Yeah,
coming in leading with our heart saying we want to help you be able to deliver the goods in the best way possible. So we're
for
looking
sure.
forward to it. Again, each week we'll drop some content. Stay tuned. Please share with others, with other docs out there that are in the space, whether they think they want to be or whether they don't. It's going to apply to everybody in every walk of the profession. So we
Yeah.
appreciate that in advance and look forward to being with you next time.